During this presentation, we will examine how behavior analytic principles can be applied to health and fitness behaviors with a focus on assessments, interventions, and case designs, the use of technology, shaping healthy behavior, and the long-term benefits of its application. Behavior analysis in health and fitness has almost 60 years of research and dates back to the 1970s when medical researchers found that physical activity had a huge positive impact on a person's overall health. In the late 70s, this is where behavior analysts became involved. And there was a study in 1979 where behavior analysts attempted to get college students more engaged in physical activities upon these findings by the medical community by implementing a token system that was contingency based, and they found that this simple intervention increased physical activity for students. Research of behavior analysts in health and fitness began in the 1970s, and medical research by the CDC then later recommended 30 minutes of moderate to rigorous exercise at least 5 times per week. And the types of physical activities that the CDC recommended were planned exercise sessions and daily routine activities. So, what role do behavior analysts play in health and fitness? A behavior analyst's role in health and fitness is to apply behavior analytic principles and concepts outside the healthcare system by promoting healthy behavior through diet and exercise. And they can do this in many different ways. Some of them is working directly with individuals, healthcare professionals, dietitians, and personal trainers to help individuals achieve those meaningful changes in health and behaviors. This includes fidelity and commitment of those individuals to the dietary and physical activity regimens that are created and intervention systems in place to improve the individual overall health. They do this through 3 levels of health, which is primary, secondary, and tertiary. So primary is focused on promoting regular physical activity to prevent chronic diseases and encourage healthy eating habits to maintain optimal weight. It also puts an emphasis on education and stress management techniques to improve mental health, which does have an effect on those health behaviors. Secondary is screening, and this is implementing routine and health screenings to detect issues early on, using fitness assessments to identify areas for improvement, and monitoring vital signs regularly to catch potential health problems. The last one is tertiary, which would be treatment. And this provides personalized fitness programs for rehabilitation, offers nutritional counseling for managing existing health conditions, and support of mental health through therapy and wellness programs. So, some of the main concepts and applications of behavior analysis in health and fitness, and some of the most important concepts and principles to consider when implementing behavior analytic interventions, is understanding motivating operations when designing interventions for exercise adherence or dietary control, positive reinforcement, which also can include token economies, money, tangibles, or behavioral contracts, and abolishing operations, negative reinforcement, immediate feedback, which we will go over later on, and just emphasizing on implementing token economies. Preference assessments are absolutely necessary to identify what individuals are willing to trade tokens for based on achieved short-term goals. So, looking at assessments and tools, we know that effective interventions begin with assessments. And in the health context, this often involves identifying antecedents and consequences, such as the time of day or the immediate reinforcement from food or avoidance of effort. So, some ways definitely to look at the behavior aspect and define that functional relation would be ABC recording. And another way would be through direct assessments. So when we're looking at direct assessments, this would be an example like we're looking at a workout session. So going to the gym, going to a fitness class, and recording the minutes of the physical activity, what physical activity was done. Another way would be getting a permanent product through smartwatches or other technology, which would be like step counts, breaks in the day, things like that. And then continuous monitoring would be another form of that. Indirect assessments would just be self-reporting. It could be a fitness journal that you're keeping track of your fitness journey, questionnaires, interviews, rating scales, things like that, which just have a little bit of bias, but is also there to help to distinguish what are those functional relations when trying to create a behavior, trying to create an intervention in health and fitness. The next thing we want to take a look at is interventions and case designs. And so when looking at interventions and case designs, we know that self-management is fundamental to health behavior change. And this is where individuals collect their own data, contact reinforcement contingencies, which increases independence and long-term maintenance. Some of the case designs we have would be single case designs, multiple baseline design, reversal designs, and changing criterion design. Just to elaborate on each of those, single case designs would be the most simple one, and this just is where participants would serve as their own control, baseline, and intervention. Looking at multiple baseline designs, we have multiple participants where we would be starting them with different interventions and reinforcements at different times in a schedule and looking at what is working and tracking that behavior. We have reversal designs, and then we also have changing criteria design. And this just looks like increasing total amount of steps, the duration, or the intensity of an exercise. Now, some of the interventions we have and we'll go over would be self-management, self-monitoring, and then behavioral coaching, which would also help to shape that healthy behavior change. So self-management and self-monitoring is a very important aspect of behavior analysis in health and fitness. And this requires that individuals can select their own personal fitness and health goals, choose a behavior change strategy, whether it's positive reinforcement, negative reinforcement, track these goals and record progress, maintain accountability, meaning implementing with fidelity, no cheating, and evaluating their own progress. So what needs to change? How close or far from you to are you from the goal? And what will help you achieve the outcome that you want? So next we want to look at health as a behavior. And we know that in nutrition, behavior analysis helps individuals make better choices by modifying their environment. This looks like keeping healthy foods visible, such as bananas, apples, those kinds of things, and reinforcing positive, which overall would be reinforcing those positive eating habits. Behavior is also highly context dependent. So by arranging environments like placing your workout clothes in visible locations or taking out weights and making them visible, that is also likely to increase the desired behaviors through stimulus control. Tracking what you eat and the intake of calories is another healthy behavior as long as it's not overdone and is actually used in many health and fitness programs. Environmental manipulation is another way to reinforce and generalize health as a behavior by creating or joining social support groups, having a workout buddy that helps keep you accountable to those workout plans. And another way to manipulate the environment would be to reinforce healthy habits would be not buying sweets or cupcakes and limiting yourself from those social events where you would be surrounded by unhealthy or tempting foods. So I know as a teacher, when they are trying to do nice things for us, it's always with donuts and sweets and things like that set up in the main staff room. I just avoid going there altogether, as those things would be tempting for me. So it's making those small decisions in your day, where you want to be, what you're going to do, that is going to help shape those healthy behaviors and reinforce them. Creating a schedule is another way to change your environment, as you can look at when you're going to be eating, when you're going to be having a snack. Having those things set up on a schedule is also very beneficial. And there's multiple studies that show optimal times of day where eating full meals is really good for you versus what times of day you should probably avoid doing sweets and snacks and things like that. Technology enhances behavior change by providing real-time data, prompts, and feedback, making interventions more consistent and scalable. Technology Advances include mobile devices, wearable sensors, biomarker detectors, and real-time access to information and technology. These tools are used to assess and modify a range of antecedents and consequences of unhealthy and healthy behavior. So benefits to technology like smartwatches include enhancing health monitoring through real-time data collection, promoting physical activity by tracking steps and workouts, and having the user be in user engagement increase with notifications and reminders of health goals, as well as giving immediate feedback. So benefits in using behavior analysis in health and fitness include individualized plans, data-driven decisions, and long-term sustainability. Unlike fads, diets, or trends, behavior analysis relies on data and individualized interventions, leading to more sustainable outcomes. So, looking at the limitations and challenges of behavior analysis in health and fitness is ensuring behaviors are generalized across settings and maintain over time long term. Some researchers argue that research tools are limited in this area. There's a lack of attention to individualized differences, an over-reliance on randomized controlled trials, and then generalization and maintenance long term is not known just based on the fact that these individuals in these studies are not followed up on through a long period of time. So there is lacking data in that generalization and maintenance long term. So what's next? What does the future hold for ABA in health and fitness? The future of ABA in health includes scaling interventions through technology and integrating with broader healthcare systems. This is to improve the overall public health, and this also is referring to telepractice, which is telehealth, and this involves the use of telecommunication technology to provide education and interventions to clients from a distance. In most behavior analytic research on telehealth, the experimenter coached caregivers or staff through live video and audio internet connections to conduct assessments and implement interventions with clients. So as technology improves over time, this is the direction that behavior analysis will be having in health and fitness.